All right, guys. Happy Friday. You know what that means. Tomorrow is Saturday, the weekend. So, every Friday, as you all well know, we do a Facebook Live. And today we're talking about sore throats. We're talking about sore throats. We got Steph as the camera girl today, and she's watching, apparently. Are you sharing?
I was trying to share it, yeah.
Oh, so she's going to be helping us out. So today we're talking sore throats. Happy Friday again, everybody. We've got a huge thing planned. We're doing some testing. Boom. We're doing some other stuff. Boom. But let's get going. So as you all know, we always get started with, hey, Ashley, what's going on, my sister? We get started with really just basic anatomy. So, actually, before we do this, let's turn this thing down. Oh, Steph, you're in the picture. What's up, everybody? Oh, no, it's on me.
Oh, okay.
There she is. Say what's up, Steph.
Hey, guys.
Hey, Steph. What do you like most about being at the Peds office?
Watching the children grow.
She likes to watch them grow. Like Miracle Grow.
That's right.
Okay. Now, don't forget, guys, stick around to the end because we have a really cool giveaway that we're going to do. So, I wonder if we need to do... Yeah, you can go ahead. Steph's going to flip it. I wonder, should we do the giveaway? Let's see.
I got you.
Did you get it?
Yep, you're good.
All right. So, let's get started by talking about sore throats. Now, I know when you first think about it, you think to yourself, a sore throat. What could go wrong? But as you're going to learn today, there is a million things that can happen with a sore throat, especially in the young ones. So we're going to go through all of that, and we're going to try and get through as much as we can. We might have to cut it short. If we do, we may do like a sore throat part 2 or something like that. I was watching last week's video to critique myself, and what I thought was, did I get too nerdy? Was it too nerdy last week? Give me a thumbs up if it was not too nerdy, because I know sometimes I totally geek out with lots of terms and lots of things, but my whole goal is to keep this simple, like regular language so that everyone can understand what I'm saying even when I stutter. So the whole point of the sore throat is what could go wrong, a million things, and we're going to talk about a couple of those today. Okay, so stick around if you want to hear about the famous strep throat. All right, we're going to go over strep. We're going to go over something called strep's evil brother. Okay, I'm not going to reveal that one yet. You'll have to watch. So strep throat's evil brother that we actually cannot treat. Ooh, the suspense is killing me. We're going to talk about tonsil stones. Some of y'all have heard about tonsil stones in the past. We're going to talk about enlarged tonsils and why that's a big deal. Okay, and then finally, to wrap it up, we'll talk about some things that are not necessarily related to the throat itself, but why it can be sore. So like postnasal drip, don't let me forget. So, okay, let's go over some basic anatomy. Steph, I'll take the camera.
Okay.
Let's see. Okay. All right, so as you all know, we always get started with some basic anatomy, and it's always super, super important. So this is a cool little drawing out of a textbook. So everyone knows that this is a mouth. You're looking up into the nose. That looks good. Okay, and this is what we are looking at when we look at it's called the oropharynx. Okay, the pharynx is the back of the mouth there, and then the oral part of that, or the mouth part of that. Okay, you've got the tongue, the little dangly thing there. Does anyone know what the dangly thing is called? I bet Steph does. It says it, the uvula. That's right, we're going to talk about the uvula in just a little bit, but the dangly thing is the uvula. We've got over here, these are called the tonsillar pillars. There it is, I found it, tonsillar pillars. And then moving down, those things right there are the tonsils. Now, these tonsils, believe it or not, are kind of enlarged. Okay, they're kind of big. And we're going to talk about what that looks like right now. So, like I said, we've got We've got textbooks out the yin-yang today. Oh, we got some sick throats. We're going to talk about this in just a little bit. We're going to talk about this guy. This is classic. That's bad, actually. And we're going to talk about this guy. That's a bad one. All right. Let me put him on the side. Okay, now, so let's go back to the throat. So this little picture here, this little diagram, is if you're looking into the throat, all right, and you're seeing, again, what you're looking at. So the tongue would be down here, the top teeth up here, the bottom teeth here. Now, this is kind of a grading system for the tonsils, and this gives us an idea of how big tonsils actually are. Oh dear. Did we lose our internet? I hope you guys are still live because our power just flickered. Am I still live, Steph?
I think so, yeah.
Okay. All right. If the power goes out, I'm sorry. I'll get back on. Now, here's the tonsils. This is a 1+. Okay. This is kind of like just tonsils that I would call reactive. Okay. That's not super impressive, but you can see them kind of coming out from the pillars. Next up, believe it or not, is 2+. All right. So we're going rocket science here. So 2+, that's when they get a little bit bigger. 3+ is when they're almost touching the uvula, coming down, but they're not quite there. So they're coming on out. And then 4+ is, some of y'all may have heard the term kissing tonsils. So that's what it is when it's 4+. Okay? Now, let's talk about what happens when you get strep throat. Let me see if I can get one. Okay. Let me turn this around. So, oops. Here we go. All right. When you have a kid with classic strep throat, okay, you have something called the Centaur criteria that we go on, and it has a lot of things in there. Basically, if we have a kid that has fever, sometimes they'll have belly pain. So believe it or not, if a kid comes in with belly pain, strep is on the differential what we're thinking. Anterior lymphadenopathy, which is the lymph nodes. How many of y'all have ever had a sore throat and it's just right here where your beard is, okay, right there where your lymph nodes are coming out and they're very tender to the touch. So anterior chain lymphadenopathy, or lymph nodes that get sore, fever, and basically a very, very red throat. Sometimes you can have a headache as well. When we see all of those things, or any combination of those things, the number one thing that we're thinking normally is strep. This kid may have strep, okay? With strep throat, the biggest deal is getting that treated, because if you don't get that treated, you can have some really, really, really scary problems that happen down the road, okay? You can have issues, really, really bad issues with your heart, okay? So it's very important to come in to get that looked at. You can also damage your kidneys, okay? It's called, let's see if I can do this, post-strep glomerulonephritis. That is a $5 word. That's what I'm talking about. So this kid normally looks like this. Hey, Mr. Chris, my 2-year-old was at daycare, and they've had a lot of very sore throats going around, and now my kid has a temperature of 102 degrees. They're very, very fussy. They're drooling some, and in general, they're just very sick, okay? Again, when they're 2, sometimes you can ask them, does your head hurt? And they'll say yes. Sometimes they won't. Sometimes they'll have belly stuff. Sometimes they won't. But when we are doing our exam, that's going to be high on our differentials. So for everybody at home, I'm going to show you what a strep test, what it looks like. We're actually going to do one on me. So stay tuned for that. So we would do a strep test. Do you want to go ahead and do it, Steph?
Sure.
Should we do it? Okay.
Let's do it.
Let's do it. Okay. Well, first, let me show you what it would look like when I look into their throat. So flip that thing over, Steph. Okay. Steph Gatton, what's going on? So when we looked into a throat, if it looked like this, that's like a pin light or something. You see these tonsils are coming out. They're kind of big back here. This uvula it's actually going back because they're probably saying ah. But I hope you can see this. Can y'all see all those dots, the red dots back there? That's called palatal petechiae. Okay, palatal means this, where the hard palate goes into the soft palate there. And the petechiae is these little red dots, and it's literally like little tiny busted blood vessels. And this is all highly, highly suspicious of beta streptococcal infection or strep throat. Now, if you don't believe me, look at the words. Highly suggestive of group A beta streptococcal infection. Okay? Who knew? That's right. So when I'm doing my exam, if I look in and I see a throat that looks like this, oh, you better believe we're going to be hitting up that strep test. Now, okay, I'm kind of nervous. Okay. All right, so when you come into the office, we have a way of testing for strep right here in the office. It's called a rapid strep test, and normally the kids get a little nervous. And now I know why. Okay, so basically we have a million of these little Q-tips, and this is what it looks like. And I'm going to show y'all how to do it. Now, the biggest thing with this, okay, is you have to really get back there, and you have to really swab around. Oh my gosh, I hope I don't throw up right now. Okay, but you have to get back there. You got to get a good swab. I'm just going to give you a little heads up. A lot of kids will fight us, okay? But it is so super important to get a good quality test, because if not, if you don't get all the way back there and you just kind of do a little dinner bell in there, a little dingly ding, whatever, you're not going to get a good test, and they may end up again with like heart disease or kidney injury later down the road. So, okay, here we go. Okay, so kids, I want you to know that this doesn't hurt. It doesn't hurt at all. Okay, here we go. Are we ready?
Can I do it?
I don't know.
No, Tisa.
All right, here we go. Here we go. Okay. Are you ready?
I'm ready.
Am I ready?
No.
Okay, here we go. Okay! We got it!
No, I don't think you did.
You don't think I got it?
No.
You sure, Miss Steph?
No.
Because I'm crying. Okay, we're going to let Steph do it, guys. Steph, show us what the MAs see when they're going in. Okay, first get a good shot of mouth. Oh, the things I do for you guys, okay? All right. Okay. Oh, okay.
Did I get it?
You got it.
Okay.
We got it. All right. Now, what we'll do with this swab is we'll go back to our lab, and I basically put some solution in this little tube here. All right, and we'll just let this sit up. So we let this go for a minute. All right, we spin it around 10 times, and I don't have a timer. We're just going to pretend like it's been 1 full minute. So our timer goes off. We squeeze the tube. All right, and then throw that away. And then these are our little testers. So we just put that in there, and we'll wait 5 minutes, and we will see if Mr. Chris has strep throat. All right. Whew, I'm glad that's over. All right. Now, awesome. So let's look at another throat real quick, because we're going to talk now about strep throat's evil twin. I can't believe that took 15 minutes. Okay. We may have to do 2 episodes. I don't know. All right, so let's see the thing here, Steph. Now, this... So again, the story would be the kid has... thank you. Yeah, that's good. Hey, Jesse Rogers, what's going on? So a kid comes in. They have a fever. They have a sore throat. And... maybe like some diarrhea, okay? And this is what you see. Now, well, let's not do that actually. Let's do this one. Woo, look at that throat, y'all. That's rough. So a kid comes in, this kid is gonna come in, the classic age for this person is gonna be probably about maybe 13 to 15 maybe. And they come in and the chief complaint is, they've had a mild fever. All right, and they've been really sick, and they've been very tired and very fatigued, and they're, let's see, What else would happen? Very tired and fatigued, sore throat, and it's been going on for like maybe a week, okay? So I'll look in, and then this is what I see. So again, you've got the tonsils, they're coming out. These tonsils are what's called exudative tonsils, and it's where you have this, what's called slough coming off the tonsils, okay? This person right here is gonna have one of two things. They're either gonna have strep throat, or they're going to have mono, all right? Mononucleosis. Some of you have probably heard of mono, but mono is strep throat's evil twin, okay? And I'll tell you why. There is no cure for mono. There's not. In fact, I was just reading an article that said 80 to 90% of adults have actually had mono in the past, okay? So it's very common, okay? But again, we get these, most of the time it's a teenager that comes in and they're very, very tired and they're fatigued. Although we have diagnosed it like, 18 months maybe? 18 months old. We've had positive mono titers. And so we look in, the strep test is negative on these kids, okay? And we'll get into this in a minute. But the strep test is negative, and yeah. It's like, well, your throat looks terrible. What is this? Oftentimes we will do some blood work to really kind of figure out what's going on. If it comes back positive for mono, there's a couple of considerations with mono. If you have mono, the anticipatory time to be kind of ill is like about 6 weeks or less, hopefully. But the biggest thing that you can do, the only thing that you can really do is rest, right? Lots of rest and fluids and supportive care, so Tylenol and Motrin. And that's basically it. That's all you can do for mono. From a clinician standpoint, my big concern with that is going to be making sure that their spleen is not enlarged and making sure that their liver is not enlarged. And there's a lot of reasons behind that. Just for the purposes of this video, just to know that if you have a 15-year-old kid and he comes in here and he tests positive for mono and his tonsils look like this and he's had this sore throat, he will not be playing football, y'all. And the reason why is because if your spleen's over here, if it's enlarged and you get hit in the stomach, your spleen's gonna rupture, all right? And that is a surgical emergency. So that's mono in a nutshell. It's again, if you have a kid that comes in and they're kind of on the borderline and they're kind of sick and they're kind of tired, oh, Chastity, I see Jesse, and I see Mary. What's up, Mary? Tell Peanut I said hey. So that's mono, okay? Now, continuing on with the sore throat stuff, I do want to show you a very important picture, okay? And this is something that can sometimes be missed, and there's a few other things, and then we'll probably wrap it up because we have to do giveaways today, and let's see if I have strep. Now, guys, this is like a pregnancy test. Okay?
Are you pregnant?
I'm either pregnant or I'm not, okay? But if you see 2 lines, you are impregnated with strep, okay? If you see 1 pink line, you're not. So let's see what we are. Steph, what are we?
You are negative.
I'm negative. Okay. So, no strep here. Thank you, Lord. Now, there is something else I want to talk about that, frankly, sometimes is overlooked by some people. Okay, so let's turn that thing around, Steph. This throat looks really, really bad. Let's see. Let me turn it like that. All right. Jordan said, thank goodness. So looking into this throat, you can see that big thing of tissue right there. All right, that big thing of tissue. That is the uvula, believe it or not. That uvula is, again, that little dangly thing. Let's look at it over here. All right, that's a normal looking uvula in the drawing. That is a normal looking uvula hanging down. This one up here, not normal. You see how big and beefy, red, and angry that is? That is called uvulitis. Uvulitis, and that's an inflammation and infection of the uvula hanging down. Now, again, just reading the words here, it's normally caused by beta strep. Okay, so strep can sometimes cause that. Okay, that's just another little deal to kind of look for, and something that we look for when patients are here. Now, let's talk about another patient. Let's say a patient comes in and they have a fever and they have a sore throat, and we are trying to figure out what's wrong with them. Let's say this patient is, let's say 24 months old. Okay, and the mom says they have this really, really weird rash. It's present on their hands and it's present on their feet. And when I look in their mouth, it looks like that. This is really kind of a bad picture because you can't see where the tonsils are, but y'all can see these lesions, I hope. If you can see them, give them a thumbs up. Okay, these lesions are highly suggestive. Oh, Jordan answered the question before we got it out. Let's come on down. Enterovirus. Enterovirus. That is the virus that causes hand, foot, and mouth. Okay? So again, you will see this. This is so weird. I know this is like the weirdest thing, but you will see that on their hands, on their feet, and on their mouth. Okay, so that's it. Hand, foot, and mouth. Okay, that's yet another reason for sore throat. Now, this last, I think this will be the last one just because we're running out of time. This last one is going to be, what happened?
You had it on me.
I had it on the camera person. This last one is very, 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 very important. And again, this is kind of the reason why if anyone has a sore throat, especially people with little kids at home, if they have a sore throat, they really should be seen, preferably here, but by a medical professional, because there are some sore throats that are a true, legit emergency. Okay, we're going to talk about one of those. I can think of a couple, but we're going to talk about one of those right now. There is something called a peritonsillar abscess. Okay, and if it's severe enough, then you may need to go to the operating room to get that fixed. Okay, normally these people, they have severe, severe pain, they have fever, they're very sick, and it's on one side of their throat, I guess. Sometimes they will kind of have...
Question.
Oh, Julie Queen said, is strep going around now? We haven't had a whole lot of it recently, but I actually diagnosed someone with strep this morning. So, I guess technically it's always kind of going around, but right now when school's not out, we don't see it a ton. When it's back to school time, y'all, it is crazy because all these little people come in and they have their hands in their mouth, and then they put their hands in other kids' mouths. It's epic. And then they all end up with strep. So right now it's not super, super prevalent, but it is, it will be pretty soon. So back to the peritonsillar abscess. These people are very sick. They kind of lean to one side, and it's because they're trying to get pressure off of their neck, basically. So I'm going to show you what that looks like if you were to look in someone's mouth with a peritonsillar abscess. Okay, again, these people are going to be pretty sick. They may even have trouble breathing, and I'll show you why right now. So, let's see. So this guy actually has one, and he looks super, super sick. All right, and this picture right here was actually taken. I'm going to see if I can get. Let's see. That's okay. Let's see. There we go. Hopefully y'all can see that. This picture was taken in the operating room. Okay, thank you. So this is the surgical instruments kind of going in. This is actually where they're breathing. Okay, they intubated them. This over here is the uvula. That is not in the middle of the mouth. Okay, I don't know if you guys can see this, but all through there is one big abscess. Okay, what is an abscess? It's a fluid-filled pocket of infection and pus. So they would have to go in and literally cut that and drain it. And again, this is an actual emergency. So let's see, we got Brian. What's up, man? We've got Katie Moore. What's going on, Katie? Yeah. So that's that. All right. Oh, I did it again.
You did it
Sorry.
again.
All right, guys. So listen, that's just a little bit about strep throat. I did want to talk about one more thing that we have here in the office. These episodes are going longer. It's like 30 minutes. It's crazy. We have a special swab that we can do here. All right. And this is a panel that we actually have to send off. It goes to Alabama. But it tests for, I'm just going to go through the pharyngitis. Pharyngitis is the inflammation and irritation of the oropharynx, again, the back of the mouth, okay? One swab, that's all, okay? It tests for adenovirus, enterovirus, coronavirus. There is a coronavirus, people. Look it up. Look it up, people. Okay, look it up. Flu, we've got A and B. RSV, rhinovirus, strep, mycoplasma. I mean, it's really awesome. So if you feel like your kid may have a combination of a strep throat and a viral infection, we can test for both with one swab. One swab, that's all. So, I was supposed to talk about postnasal drip. Let's see. I'm just going to do this real quick. Let's see. Okay. Hope you guys can see this. I'm just going to talk about this really, really quickly. So, let's do this.
I've got it on there if you want.
You got it?
Yep.
So this is actually a thing. I'm going to do this later. Common cold versus the flu. This is a pretty cool one. Little slide. But basically, you can see how in the nose, you can see all the inflammation and all that drainage. Okay. This drainage is going to come down the back of the throat, and commonly when people have an upper respiratory infection, they will have a stuffy nose, and that stuffiness drains down the back of the throat, and they end up saying, oh, I've got strep, I've got strep, I've got strep. But it's actually not. It's just drainage that's coming down. And then it goes down here, and then it drains into the lungs, and then they end up with a cough and bronchitis and everything else. So, or in peds, bronchiolitis, right? So that's a little bit about postnasal drip. I know it's just a little snip of that, but I did want to share that because it is a cost too. Now, let's take a second. Does anyone have any questions, Steph?
Stacy says it's time to eat.
Stacy says it's time to eat. Hey, it's hard to argue with that. It's thundering here at the Peds office in Murphy. So I promised you guys we were going to do a giveaway today. So on top of all my articles that I've been looking up, on top of all my textbooks, I have something really cool. And I picked this up mainly because I love you guys and I want to do a giveaway. So I'm going to give some away. All right. This is called a Hunter in a Bottle. And I haven't even looked in here to be honest with you. Let's see. So I'm going to look in here real quick. So this is, let's see, we got a flashlight. All right, we got some batteries.
Getting lots of love on the giveaway.
Lots of love on the giveaway, okay. We've got a waterproof thing with a compass and, a whistle. I'm not going to blow that. There's some other stuff in here. A Mylar blanket. We got, looks like some hot hands maybe. And, an orange vest. So if any of you guys like hunting or if you guys know a hunter in your life, I'm gonna, oh dear.
Or hiker.
Or a hiker. That's probably a good idea. I'm gonna just smash all this down here. Okay. I'm doing a giveaway. Now, there are some rules to the giveaway, okay? We're gonna do the drawing next week. Okay, so we're gonna give this away to someone, and if you live far away, then I'll just ship it to you. Okay, I'll private message you and I'll Facebook, through Facebook, and then I'll ship it to you. But basically, all you have to do is just share the video. That's all you have to do, share it. And the people that share the video will be entered for a giveaway for the Hunter in a Bottle. And if you really want to make it funny, you can, I don't know, tell a funny story with it, or tag a friend and say, hey, you're going to get lost in the woods. Do the Hunter in the Bottle, okay?
How about their favorite Mr. Chris moment?
Steph wants to do their favorite Mr. Chris moment. If you want to do that, that's fine, but it is not a requirement, okay? All right, guys. Well, it's almost 1. We've got patients that are here in the office. Thank you so much for joining in. It's always a pleasure to see you guys. I watch these things like these British YouTube videos for some reason about random stuff, but they always say, smash that like button, okay? So smash it. And that's it. So if you guys have any questions, make sure to give us a call and share the video. Get the free bottle, man. See you guys. Bye.